Thank you. As I'm sure you've seen in the news, the novel coronavirus called COVID-19 has been spreading to a growing number of countries around the world, including the US, and understandably, this has people in Vermont worried. I'm here to tell you what we in public health know, what we don't know, what we're doing, and what you can do right now to help keep respiratory illnesses, including COVID-19, from spreading. Because this virus is new, meaning it's not been seen before in humans, there are things we don't completely understand, like how easily it spreads, what proportion of people who are infected will have a milder illness, and why it seems to be that older people and not children have been affected. Because it's spreading widely around the world, it may soon be designated by the WHO as a pandemic. But just because it's a pandemic doesn't mean it will cause severe illness. We know that a lot of the current cases only have mild illness. We also can't predict whether the virus will fade away in the spring, only to return more strongly in the fall. At this point, the scientific community knows less about this virus than other viruses. What we do know is that person-to-person spread occurs mainly through respiratory droplets when an infected person coughs or sneezes, similar to the way flu and other respiratory illnesses spread. Symptoms look a lot like other respiratory viruses, and seasonal flu is still widespread in Vermont. As yet, there appears to be no sustained person-to-person spread in communities in the US, but we can expect that there will be, so now is the time to start preparing for what that fight might mean. There have been no cases in Vermont of people with COVID-19, but we expect there will be. Since the virus first emerged, the health department has been in constant contact with the Centers for Disease Control and other states to closely monitor developments and work to minimize the spread of illness. And we're adjusting our response as the situation changes. We opened our Health Operations Center in early February in response to COVID-19. This has allowed us to work across the department to implement guidance as appropriate to the situation in Vermont, with staff from Vermont Emergency Management as part of that initial HOC team. We've been alerting healthcare providers and providing guidance and updates on our website via our Health Alert Network and the news media. The health department has the CDC test in our lab. Once the routine quality assurance checks are completed, testing for COVID-19 can be performed here in Vermont, perhaps as early as next week. As you know, the part of the world that has been highest risk for transmission has been China. Because of this, public health nurses and epidemiologists have been monitoring people who have returned from travel in China and a few from other affected countries. Monitoring means checking their temperature every day, watching for symptoms, and for some people, asking them to stay home. For other countries, there is less risk, and it is spreading globally, so it's impossible to get a handle on everyone who may have been exposed. That's why we're asking people to be aware, watch out for symptoms if you've traveled, and stay home when you're sick. If you have traveled to countries where there is transmission, we ask you to contact the health department. The phone number is on our website. We'll let you know what to look for and guide you on what to do if you develop symptoms that could be from coronavirus. We'll also offer to touch base with you a few times a week if that would be helpful. To date, 27 people are being monitored, and 15 people have completed their monitoring here in Vermont. In coordination with the CDC, we are preparing for further person-to-person spread in the U.S., Because of that, we are continuing our monitoring to identify cases and planning for community-wide strategies to slow disease transmission. These could include social distancing, also called non-pharmaceutical interventions, to limit where and when people come together, such as teleworking, restricting mass gatherings, closing public facilities, and the like. There's no need to exercise any of these options at this time, but now is the time for all of us to prepare mentally and logistically for possible disruptions to our daily lives. The Health Department will begin working with Vermont Emergency Management to ensure that state agencies and communities, schools, businesses around the state are prepared to minimize potential disruptions. What should Vermonters do? Right now, the most important thing is that everybody take the actions that can help prevent the spread of respiratory illness. Things we've told you many times before. Washing hands often with soap and water for at least 20 seconds. Using an alcohol-based sanitizer if soap and water aren't available. Covering your cough or sneeze with your sleeve or a tissue, not your hands. Staying home when you're sick, especially with a fever, except to get medical care. Avoiding close contact with people who are sick. Avoiding touching your eyes, nose, and mouth. Routinely clean and disinfect frequently touched objects and surfaces. And always remember about the flu, which is still prevalent in Vermont, and get your flu shot if you haven't yet. As always, prepare yourselves and your families for all hazards, including the possibility that you might need to stay home for a few weeks. And stay tuned. Things evolve rapidly in terms of our state of knowledge. Get the most current information at the Health Department's website, healthvermont.gov. Contact from the Centers for Disease Control is automatically pulled in there, so our site will reflect the latest information and guidance, in addition to Vermont-specific updates and resources. Now I'd like to turn this over to Eric.
Good afternoon. My name is Erica Borneman. I'm the Director of Vermont Emergency Management. In order to be prepared for the use of non-pharmaceutical interventions or community mitigation measures, as they're sometimes also called, the Governor has directed Vermont Emergency Management to assemble an interagency task force to ensure comprehensive COVID-19 response. While we hope we will not need to use such measures, it is important that we prepare to do so if necessary. The composition of this task force is still under development, but it is our intent to begin work in the immediate future to ensure all planning considerations are addressed in a coordinated fashion. As Dr. Levine just previously said, the Health Department is leading the effort to prevent an outbreak in the state of Vermont. But it is as the nation shifts its focus to mitigation strategies rather than containment strategies, we may need to do so as well. The state of Vermont has plans for multiple potential hazards in the State Emergency Management Plan, including pandemics, which have been guiding our work to date and provide the framework for the tactical work we're undertaking now. State agencies also have continuity of operations plans to ensure essential functions of government are maintained in times of emergency. An additional assignment for the task force will be to recommend continuity planning actions the state government enterprise should undertake. The task force will also work on a comprehensive communications strategy to ensure steady information flow and resources are available throughout all sectors of the public, including schools, businesses, healthcare facilities, emergency responders, and local government. The state of Vermont has a well-prepared team of emergency managers and state agency partners that work together to address emergencies of all scales And we will approach this potential incident as we do many others by exercising an abundance of caution and ensuring we have the capabilities to respond if necessary. I want to thank the Department of Health for its continued partnership as we address COVID-19 and encourage Vermonters to stay informed and follow public health guidelines for reducing the spread of all respiratory illness like flu and COVID-19. With that, we'll open it up for questions.
When did the governor issue the order for the task force?
The governor has communicated his desire that Vermont Emergency Management assemble that task force as of yesterday, and it's currently in development.
Okay.
So you mentioned 27 people are currently being monitored, and then 15 have completed being monitored. Is that enough to a total of 42? Or are the 15 included among the 27?
Two separate numbers.
So it's 42 is the total?
And Dr. Lind, you mentioned that the state will soon be able to test for the virus. Was that
Yes.
wasn't the case before? So can you just go into a little bit of
Yeah,
more on
so
that?
prior to right now, all testing had to be sent to the CDC. The CDC has now made it possible with the appropriate reagents and testing protocols for states to do the tests within their borders. I would add that we have actually not had to test anyone in Vermont thus far.
And what would the turnaround time be? Like, assuming you can do the tests, like how quickly?
Yeah,
would the
I believe
turnaround
it's within 24 hours.
24 to 48, I would say.
24 to 48.
And where exactly would that take place?
At the Vermont State Health Lab.
Okay. And do you anticipate that you'll have the ability to sort of manage the volume of the tests that may be required?
Yes, we do.
How many can you handle? Like how many cases could you handle?
We'd have to get
Well,
back to you on that. We'd have to check
Can't
with the
tell you
lab.
that yet.
It's a significant proportion of the Northeast Kingdom and other parts of Vermont is volunteer rescue services. The first responders are all volunteers. Are you guys taking any kind of special education or anything for those people? Because a lot of them don't have all the training that professional paramedics would necessarily have.
Well, again,
Show up in their street clothes to a scene to deal with a problem without necessarily having everything that they would ordinarily have.
yeah, well, our EMS services statewide are part of our entire health operations center, and everyone's getting the same messaging and the same instructions and resources as well.
When you said that, I believe it was 15 people are being monitored right now.
They were the original people who arrived from China, and their monitoring period of 14 days has been completed for all of them now.
Okay.
So there's 27 additional.
And are they in a hospital right now being monitored?
No,
or-
these are all people who are asymptomatic. They arrived from another country with no symptoms, felt well. So we're monitoring them for the development of symptoms, not because they're sick.
So are those people at home though? Are they like required to not leave their houses until that period's over or?
No, the current guidance from the CDC is that as long as we're doing the appropriate monitoring and they have no symptoms, they are free to go about their lives.
Dr. Levine, you said, and the governor has said too, that there are no cases in Vermont. Would it be more accurate to say there are no known cases?
Yes.
In the grand scheme of all the threats you face in your public health life, how does this rate as something? I mean, is this something, does it keep you awake at night more than other things?
Well, the only thing that's new and unique about this is the fact that it is new and unique to humans, and we don't have as much information about it. There are scenarios that people have trained in regarding pandemic flu that can be quite scary and keep you up at night, okay? But what we know from other nations' experience, and we're gathering this information now, is that somewhere in the range of 80+% of people who may have been infected with coronavirus in the nations that it spread in have had a milder illness. So that's very reassuring. Others are getting pneumonias, which is a more severe illness. And when there have been deaths, it seems to be in people who would be susceptible no matter what the insult, if you will, if they had a severe case of flu or another respiratory virus. As I said, this is evolving day by day. We're gaining information as each day goes by.
I remember in the, actually years ago, your office gave me the John Barry book about the 1918 flu, and I started reading it again. And it talked about how that first, in the summer of 1918, it was pretty mild, and then it kind of went away, and then it came back and started killing people. Does that worry that this mild disease you're seeing now could come back in a more virulent and lethal form?
I really can't answer that. Like I said in my comments, we don't know if, as the season evolves into spring, that the virus would peter out but then return again in the fall. That's a plausible scenario, but we don't really know.
At the risk of harping on this, if it's more appropriate to say there are no known cases, when you say no cases, is that communicating a greater assurance than is actually warranted?
Well, no, because, part of the definition of a case requires the appropriate travel history. And I feel very confident about the fact that practitioners around the state in our healthcare system, are asking the appropriate questions about travel history. Plus, initially, that wave of travelers coming in from China, on a national basis, they went to certain airports, they got asked certain questions, they were evaluated, and if needed, they were quarantined. So even if their final destination was Vermont, they would not have arrived in Vermont right away. So I feel that, the systems that were in place were quite good, and the containment strategy was reasonably effective, I would say.
Dr. Levine, do the hospitals in the state of Vermont have the capacity to deal with an outbreak?
So the answer is yes, but the fact of the matter is, as you know, this is flu season, and they do have hospitalized patients with flu and at least one or two other respiratory viruses. So it would be nice to see the flu season taper off if we were to have a coronavirus outbreak that would require a segment of the population to be hospitalized. But I think all of our hospitals are prepared, if that's what you mean. And capacity is just an issue that depends on what the timing is.
But if the outbreak were to happen during flu season, would that, worry you that there wouldn't be enough resources to help them out?
No, I don't think so. Hospitals adapt very easily, so if there was a significant need for hospitalizations, there are often other things that hospitals do to manage the other kinds of patients that might be in the hospital, because they have to have what we term a surge capacity. So they would evolve into the surge mode.
To that point, there's been reporting in other places about a shortage of respirators and people to staff them. Is that something that you all have been thinking about or talking about?
Constantly. And, in addition to our health advisories that we put out, there are weekly phone calls that Dr. Kelso was involved in with infectious disease and infectious control people at our hospitals around the state. So people know what to be aware of, and are in that planning phase again of trying to ensure they have all the supplies they need.
Well, I guess, is there anything in particular the state's doing to address any potential shortage like that?
Currently, I would say no. But again, the word surge capacity, this is all part of the planning you've been hearing. So with Vermont emergency management planning, with hospital planning, these are the things that everybody automatically begins to consider.
What is the communication like between the state and the CDC and the federal government?
Yeah, so in the half hour before this press conference, there was yet another phone call with CDC. I I can't tell you how many per week there are at this point, never mind per day. There are abundant opportunities. CDC wants to have constant contact with state epidemiologists, with state health officials, with other parts of the clinical community, and they've gone out of their way to have opportunities not only for them to give us information, but for us to give them information and to ask the appropriate questions and get answers.
What questions are you asking the CDC right
Really, the kinds of questions we've been asking all along have been more aligned with our containment strategies of preventing the spread of, or the entry of disease into the state and then preventing the spread. And now the kinds of questions are evolving into the mitigation strategies that one would do in a pandemic scenario.
When you talk about closing places of public gathering, can you talk a little bit about the mechanics of what that actually looks like and kind of on whose authority that happens?
Sure, and Eric may want to help me on this, but both I as well as the governor have authority to be able to do closings in situations that would be as grave as we're talking about. So whether it be a school closure, whether it be say a rally that was supposed to be scheduled, where there would be a huge mass of people coming together. Those are the kinds of things we're thinking about. And I think the public would actually respond very positively to that, because many of them won't be interested in exposing themselves to large groups of people, many of whom could have an infection, if it came to that degree. And I have to keep emphasizing, we are far from that at this point in time.
How do you define mass gatherings? Could it be like shopping malls, Church Street Marketplace, sports games, concerts?
Yeah, more on the latter, I would think. I would think people walking down streets would be fine. And, even when we think about your risk in an airplane, the rule is about 6 feet of distance from a person who's actively infected. So it wouldn't be as dire as some of the illustrations you provided, but certainly, a big athletic event would be fair game, I would think.
Well, the State House is a known wellspring for the spread of winter illnesses. Is there a plan to interrupt the session or hold it somewhere else or tele-session, or is there anything along those lines?
Yeah.
I can
Sure.
speak to that a little bit.
Sure.
So we work closely with the Capitol Police and the Sergeant at Arms when they are determining different types of responses to different types of hazards. And so, all of these measures that we're discussing are really part of a deliberative decision-making process with a full understanding of what the ramifications of that are. And it's really after a time of understanding what types of public areas may need to be restricted or not. But there is no current plan to disrupt the legislative session because we are not at that point yet. And if we feel like we could get to that point, then we would need to take those planning actions to make recommendations and work with the Sergeant at Arms to make plans for that.
Well, I've heard experts say that this is the time to plan before we actually face the contingency.
And we absolutely agree with that, and so does Governor Scott, and that's why he has asked DEM to assemble an interagency task force to do just that.
What would the threshold be for when a school or a big event needs to close? Would there be a few confirmed cases? What would the threshold be?
I don't have an answer for that. And, and frankly, that is a part of this planning process that the task force is undertaking, because we have to look at different scenarios and different severity indices through a pandemic, should it happen, and then decide on what decisions and how those decisions would need to be implemented.
Who's part of this task force again? I can't remember.
It's still under development. It's being led by Vermont Emergency Management and certainly in very close partnership with the Vermont Department of Health.
Do you have a cost estimate for the planning and prevention process? Was that going to cost the state anything?
We do not.
We do not.
When you talk about a surge, how much and how quickly can Vermont scale up, and what happens if, like in other countries, this doesn't exceed the capacity of the ability to scale up?
I think we'd, figure out a way to do what needed to be done and maybe have to prioritize things from a public health response perspective. And I think Dr. Levine has already addressed, the healthcare system. There are pressures on the healthcare system all the time, and they figure them out.
So there are still.
Your name and title.
Sorry. Patsy Kelso, State Epidemiologist, Department of Health.
There's a lot of unknowns, obviously, with this. I think it's a little bit hard sometimes for folks to sort through, like, how serious they should take something like this. So, I mean, obviously you're taking it seriously, but in terms of, like, what people should actually know and understand, like, at what, it's just kind of hard to try to convey, like, what level we're at when we don't know a lot of things. So.
Exactly.
Right, so, yeah, so, like, what do you say to that? I mean, like, how are you trying to, like, walk that line between not being an alarmist but not also batting this away?
Right. And I think the public has heard a lot coming out of Washington in the last week that probably has created some anxiety in them, and that's very understandable. But again, I need to emphasize that across the United States, never mind just in Vermont, we don't have abundant COVID-19 activity that we're aware of. And even if and when it does evolve, it will probably evolve in pockets here and pockets there, as opposed to all of a sudden everybody's got abundant cases. And we'll just have to see how that goes. But we also are learning a lot more about the virus the longer the world has this experience with it. And the CDC gained permission in the last several weeks to actually go to China, which has provided them with invaluable experience understanding the virus more than they did beforehand. So we hope to benefit from that as well.
But you would expect to see some cases in Vermont. You said, I think, earlier. Would you expect to see
Well,
some?
certainly in the United States. I don't want to say in Vermont, to be honest, because can't predict that. And the success of our strategies to date hopefully is reflective of that.
But bottom line, people at home or reading the paper should take this seriously. They shouldn't just brush this off as, oh, it's not in Vermont, I'm safe.
Right, they should take it seriously because of the amount of activity around the world and the amount of travel that goes on around the world. This really is a global society. And so the ability for things to land on our shores is always a possibility. But at the same time, taking seriously and getting overly concerned at a time when there's nothing going on is a delicate balance between the two.
We, BT Digger, have been trying to get access to emergency plans that I guess Vermont Emergency Management and BGS have been developing. We've been told that we need to submit a public records request. That seems a little bit obstructive to me.
John, who is telling you need to do a public records request?
I don't know. It was another person at the office who asked the question and was told that the plan would not be here, would not be available here, and that we would need to to submit a public records request for?
So every state agency, or almost every state agency, has a continuity of operations plan. And one of the most important pieces of a continuity of operations plan is determining the mission essential functions of a state agency. And so really part of the continuity planning that state government has done is understanding what we need to maintain on a minimum basis. What our plans are needing more work on, and that's part of the work of the task force, is to ensure that we're able to meet these minimum essential functions with reduced staffing. So we'll have to chase down the continuity plan discussion. Like I said, every department has one. There isn't a statewide continuity plan, continuity of operations plan, but there is department by department, and maybe we just need to hone in on exactly what department you're looking for. I will say that Buildings and General Services is statutorily responsible for continuity of operations planning, and so they hold all of the plans, but every department has a COOP planner and holds their own plan.
Yeah, I guess as I understand it, the request was submitted to BGS, so none of them are here, so they can't answer for how their department responded.
Yeah, and we may be able to just, have a sidebar on how best to handle that request and who you're actually looking for.
Okay.
To what degree are you coordinating with hospitals, and what do those conversations look like?
I'm sorry, I missed the question.
To what degree are you coordinating with hospitals, and what does that look like?
We've done several health advisories. We have a weekly call every Friday with the infection prevention staff from every hospital. Just trying to think all the other venues. There are other sort of routine conference calls that we have where we're bringing this topic up. And as we get into the next, several weeks, I think we'll be doing more and more outreach around what they anticipate their needs might be if this escalates into a bigger situation in the U.S. that, and impacts Vermont. So we've been doing some outreach and we'll continue to do that.
What do you tell them in those calls?
Mostly we're sharing CDC guidance up to this point about, criteria to meet a case definition, who they should be suspecting may be a case, what the, testing guidelines are, how to collect those specimens and get them to the CDC lab for now through our lab until we're doing it here in Vermont. Trying to think what else. The basic guideline type things.
Are you worried about this hitting low-income Vermonters harder who might not have access to healthcare, might avoid going in for testing because of the costs associated with hospital visits?
I don't really think so. And actually, if you wanted to carry that one step further, one of your higher risk populations would be a population that has traveled to other countries, which might not be the population you're talking about. But certainly, I think we have a great tradition in Vermont of providing excellent health care, and access to health care has not been a huge issue in Vermont. We're rated top of the country regarding access to health care. And in fact, the rate of under or uninsured is one of the lowest in the country. So I'm not too worried about socioeconomic status dictating the kind of outcome that might occur.
And just to add to that, while there may well be a cost associated with a visit to a healthcare provider, there's no cost for the lab test itself.
And one note, the state emergency management plan is on our website at vem.vermont.gov. and under vem.vermont.gov/plans.
Yeah, and just a little bit more about the framework of emergency plans in Vermont. The State Emergency Management Plan provides the overall framework for the interagency response to any disaster, which Vermont Emergency Management is tasked with leading. And then we have many other plans, such as continuity of operations plans, incident-specific annexes, and then procedures that come into play. And so what we're doing is we're taking what we can learn from the pandemic flu incident annex, as well as our state emergency management plan and federal resources to provide the tools for the task force to develop a more coronavirus-specific response plan.
Thank you very much.